So this is a canine parvovirus infection. It is a highly contagious disease of the dogs, characterized by the acute hemorrhagic enteritis in the adult dogs and the myocarditis in the young ones. It is caused by the canine parvovirus 2. This virus was discovered in 1977. That causes 100% morbidity. It is also believed that it is mutated from the FPL virus. It is transmitted through direct contact. The infected material like feces, soil, shoes, dog toys, and during the dog shows, breeding, during the boarding your dogs into the kennels, pet shop, animal center, etc. It is transmitted among the dogs. Regarding pathogenesis, the virus enters into the body through mouth and it takes 3 to 7 days incubation period. It replicates into the lymph node in the large amount and soon it develops the viremia. After 3-4 days of incubation period, the virus goes into the different organs of the body, especially target the rapidly dividing cells of the body. It targets bone marrow and the intestine. The villi are destroyed by the virus. As you know that villi are very important for the absorption of the nutrient from the body, and due to the destruction of these villi, the absorption affected. And this virus also breaks the protective barrier over the GI tract, and that's why the blood vessels of the superficial blood vessels of the GI tract are also affected. That will causes the bloody diarrhea. Regarding clinical findings, it's very important. The pups and the dogs both are affected, and in all the cases diarrhea is the consistent finding. Generally dogs suffered with the enteritis. They having severe abdominal discomfort due to the spasm. Early symptoms of the depression, there is loss of appetite, severe gastritis. At the initial phase of infection, there is high rise of temperature, and the diarrhea is of foul smelling and bloody in nature. Gradually, the temperature becomes normal, and the vomiting and diarrhea become severe. There is asymptomatic death observed in the pups, that is due to the cardiac form. And generally the unvaccinated pups, they are severely affected. If you perform the PM, you will get the prominent dilatation in the left atria and the ventricle. You can diagnose it on the basis of characteristic clinical finding. On the basis of PCR, you can confirm it, and then the different commercial kits are available in the market. You can diagnose. Regarding treatment, as such, there is no treatment of this viral disease, but you can go for the fluid therapy. The best fluid is the inert lactate at the dose rate of 15 to 20 ml per kg body weight intravenous, but you can vary it. This dose is vary according to a degree of dehydration. You can also prefer the combination of the RL and dextrose, as the case may be. The choice of antibiotic to control the infection, the secondary complication, you can use the ceftriaxone, that is far safer drug, at the dose rate of 15 to 20 mg per kg body intravenous. Preferably it should be given intravenous. Another antibiotic choice is there, it is ciprofloxacin. In case of mixed infection, you can go for the metronidazole, and to control the emesis, you can go for the prochlorperazine, that is Nimetal. Then Aciloc injection, that contains ranitidine. Then to control the spasm, you can give this dicyclone hydrochloride. Hemostats may be given as per the clinical manifestation observed in the dogs. To improve the hydration of the body, you can also give the multivitamin injection, that is in the form of Polivia intravenous along with the fluid. This treatment should be followed for at least 6 to 7 days, and initially 3 to 4 days the food and water should be withheld. Regarding prevention and control, the isolation treatment is must. Vaccinations is available. Multivalent vaccines are also there, monovalent vaccines are also there. Multivalent can be injected at 45 days, while the monovalent vaccine can be given at 30 days. Every primary vaccination should be followed by a booster at 1 month interval, and then annual vaccination. So that is all about the canine parvovirus infection.